In our first case study, we looked at fall preventions and physical therapy. The patient is FP, who is an 85-year-old male who weighs 170 pounds. His health conditions include diabetes, hypertension, cardiopulmonary disease, and asthma. He takes several medications for his conditions, which he sometimes forgets to take. He is a former smoker, but still occasionally smokes one with a friend. He drinks beer and has around 2 to 3 a day. FP's wife died last year, and he now lives on his own. His son visits him when he can, but with his work, he is only able to several times a month. FP has his meals delivered due to being unable to cook nutritiously for himself. There are steps that can be taken to reduce the risk of potential falls from happening. FP's family can enlist their support in taking steps to stay safe. They can ask him if he is concerned about falling. Many older adults recognize that falling is a risk, but they believe it won't happen to them. Discussing the health conditions and asking if it's getting difficult to remember to take his medications could be an eye-opener for the family. With him having Medicare, the family can make sure he is taking advantage of the annual wellness visit that it offers. People that are around FP can watch to see if he is holding onto walls, furniture, or someone else when walking, or if he appears to have difficulty walking or rising from a chair. These are all signs that it may be time to see a physical therapist. A trained physical therapist can help older people improve their balance, strength, and gait through exercise. They could also suggest a cane or walker, which could help tremendously with stability. Making FP's home safer could significantly reduce the risk of him falling. If there are stairs in his home, they can make sure there are 2 secure railings on each set of stairs. Installing grab bars in the bathroom for the shower and near the toilet is another way FP's family can prevent a fall. Lighting can be a big factor in keeping FP safe. Increasing lighting throughout the whole house, especially at the top and bottom of stairs, and also making a light readily available if he were to get up in the middle of the night, could help him see a lot better. Another way that FP and his family can have a little peace of mind is investing in a device called Life Alert. Life Alert is a medical alert system specifically designed to protect seniors and all family members in a home health emergency. It can help seniors remain independent and possibly avoid a retirement home by sending help fast in the event of a medical, fall, shower, and home invasion emergencies. For our second case study, we looked at pharmacology and medication management. We researched MM, who is a 70-year-old female living in an assisted living facility with 8 other residents. She is 5'4", 96 pounds, and is considered underweight. She has been diagnosed with hypertension, hypothyroidism, arrhythmia, macular degeneration, Parkinson's disease, arthritis, and edema. She takes 7 different types of medications for these conditions, but does not always remember to take them. She will occasionally have a glass of wine with her daughter. There are several things MM and her family can do to make taking multiple medications easier for her. The most important one is staying on schedule. Taking the pills at the same time every day is imperative to keep a steady dose of medication in the body at all times. Using a pill case is a way for MM to track what she has taken that day so she doesn't forget the medication. Setting a reminder alarm on her phone ensures she is taking the medications at the same time each day. MM's daughter also needs to be more mindful of not drinking wine around her. MM cannot drink alcohol while she's on these medications, so her daughter needs to not enable it. The next case study we look at is oral health and nutrition. The importance of good nutrition throughout the lifespan and its contribution to health and quality of life cannot be overestimated. Approximately 15% of older community-dwelling adults and 50% of hospitalized older adults are malnourished. 80% of these adults have at least one chronic disease, and 50% having at least 2. Many of these chronic diseases can be managed successfully with nutrition intervention to improve quality and quantity of life for aging individuals. In this case, we studied OHN, who is an 85-year-old male that was diagnosed with diabetes, hypertension, high cholesterol, obesity, and gum disease. He is on several medications to control these conditions. OHN is living in a low-income seniors apartment in the community and has his meals delivered through Meals on Wheels. He has 3 children who take him out to dinner on special occasions. There are things OHN can start today that will help him lose weight and live a healthier lifestyle. Healthy eating and regular physical activity are keys to good health at any age. To get down to a healthier weight, he can start eating more foods that are high in nutrients. Nutrient-dense foods pack a lot of vitamins, minerals, and other nutrients the body needs into a small amount of calories. Physical activity at any age is good for the health and can help people live on their own for a longer amount of time. It would be very beneficial having OHN sit down with a physical therapist or trainer so he could get simple exercises to help him lose weight. If OHN has a body mass index of 35 or above, he could be considered for bariatric surgery such as gastric bypass or lap band gastric banding. Gastric bypass surgery shrinks the stomach and shortens the path food takes through the small intestine. This limits the number of calories absorbed. Laparoscopic gastric banding is where a belt is wrapped around the stomach. The belt cinches the stomach so that it will feel full with less food. Either of these great options for OHN and could really help him lose weight and ultimately become a healthier person. Elder abuse is the topic of our next case study. Hundreds of thousands of older persons are abused, neglected, and exploited each year. Elder abuse is a term referring to any knowing, intentional, or negligent act by a caregiver or any other person that causes harm or a serious risk of harm to a vulnerable adult. Abusers of older adults are both men and women and may be family members, friends, or trusted others. In this case, we researched EA, who is an 85-year-old male that has been diagnosed with hypertension, arthritis, and dementia. He is on several medications to keep these conditions under control. EA moved in with his niece since he is widowed with no children of his own. He is entirely dependent on her care. EA is seen in the emergency room at least once a month for falls because his niece says he is accident prone. His meals are prepared by his niece and usually consist of fast food or junk food. He does not leave the house unless his niece is with him and is given $10 a week for groceries. 5 years ago, EA was diagnosed with dementia. Dementia is when there is a decline in mental ability severe enough to interfere with daily life. People with dementia may have problems with short-term memory, communication and language, ability to focus and pay attention, reasoning and judgment, or visual perception. It is very possible that EA is falling at home due to his dementia. Falls are the leading cause of injury-related deaths for older adults. Those who live with dementia are especially at risk. There are things EA's niece can do to help prevent him from falling. She can make sure the home has enough lighting in each room to reduce visual difficulties. People with dementia might misinterpret what they see, so reducing dark areas and shadows is vital. Those living with dementia can have a hard time recognizing the danger of a loose rug, unsteady footstool, or electrical cord stretched across the floor. Removing tripping hazards and keeping pathways clear can help prevent falls. For an older person who is at risk of falling, being able to quickly and easily call for help is vital. EA's niece needs to consider various forms of remote care technology such as a fall alert bracelet or auto detector, which can be used in case of emergency. Our final case study was on palliative care. Palliative care is a specialized medical care for people with serious illness. It focuses on providing relief from the symptoms and stress of a serious illness. The goal is to improve quality of life for both the patient and the family. Palliative care is provided by a specially trained team of doctors, nurses, social workers, and other specialists who work together with a patient's doctors to provide an extra layer of support. It is appropriate at any age and at any stage in a serious illness and can help provide along with curative treatment. In this case, we researched PC, who is a 97-year-old female that is suffering from diabetes, hypertension, end-stage renal disease, and a myocardial infarction. She is on several medications to help with these conditions and also on dialysis. PC is living in an assisted living facility where she has around-the-clock nursing care and only 5 other residents. She is overweight due to a fluid retention from the end-stage renal disease. With PC nearing the end of her life, there are things she needs to take into consideration if she hasn't already. She should appoint a proxy or agent who is authorized to make future medical decisions on her behalf in the event she is incapacitated and unable to make decisions for herself. A living will should be created by PC to ensure that her medical wishes are honored. A living will sets forth her wishes on topics such as resuscitation, desired quality of life, and end-of-life treatments, including treatments she does not want to receive. This document is primarily between her and her doctor, and it advises them how to approach her treatment. PC has already decided to sign a Do Not Resuscitate order, a DNR. A DNR is a medical order written by a doctor that instructs healthcare providers not to do cardiopulmonary resuscitation, CPR, if a patient's breathing stops or if the patient's heart stops beating. PC could also start thinking about how she wants her funeral and burial to be. Funeral planning allows her to choose the specific items she wants and needs while also sparing her family the stress of making these decisions under the pressure of time and strong emotions.